Hi there. This is Jay Lusk, your Duke University Graduate and Professional Student Government, or GPSG President, here to answer some of the most commonly asked questions about the COVID-19 vaccine rollout for graduate and professional students. First, the most common question we've been getting asked is who's eligible for the vaccine and who makes those decisions about eligibility? The answer is that the North Carolina Department of Health and Human Services determines who is eligible to receive the COVID-19 vaccine. Duke University does not decide who is able to get a COVID vaccine, and Duke University does not have the ability to go outside of the state's guidelines. All healthcare facilities in the state of North Carolina must follow the state's system for allocation of vaccines and for prioritization. The system North Carolina is using is a group system. The first group included healthcare workers and long-term care residents. Group 2 includes people over the age of 65. Group 3 is focused primarily on essential workers. Group 4 is included people under the age of 65 with a chronic health condition or those living in congregate living settings. And Group 5 includes the general population. Now, what I just described is a massive oversimplification of the state's eligibility process, but you can find full details at the website listed at this link. A lot of folks are asking what group we're in right now and how they should know if they are an essential frontline worker. And as that question alludes to, we're now moving into Group 3. Graduate and professional students who have been involved in the in-person conduct of research at Duke or who teach in person are considered essential frontline workers. Your school or program has a list of students who meet the state's guidelines and is sending that list to Duke Health or the state of North Carolina as appropriate as vaccines become available. You may receive an invitation from the state or from Duke Health to receive a vaccine as a result of being on these lists. A common question related to that is, do students have to get the vaccine at Duke? And the answer is absolutely not. If you are eligible for Group 3, you may receive the vaccine elsewhere. That includes the Durham County Health Department, Walgreens or CVS, other commercial pharmacies, other health departments in the state of North Carolina. And of course, if you're located outside of the Triangle or outside of the state of North Carolina, you can absolutely receive the vaccine wherever you're located. If you get vaccinated outside of Duke, your records will transfer and vice versa. If you do get vaccinated outside of Duke, make sure to bring a North Carolina ID or proof of residence, as some of the locations outside of the Duke system are only giving vaccines to those who can prove that they reside in the state of North Carolina. Now, there have been some communications in some schools and departments suggesting that students cannot receive vaccines outside of Duke. We have confirmed with Duke's senior leadership that this is no longer or is currently not the case. In fact, it is strongly recommended that students seek out vaccination opportunities anywhere that they can get access to them. Don't wait on Duke to vaccinate you if you can be vaccinated elsewhere and are eligible. Now, in related to this, many folks have asked, for those who've been invited to receive a vaccine, should they check the box saying that they're an essential worker on their registration form once that you've received an invitation from Duke or from the state? And the answer is yes. If you've gotten that email from Duke or from the state, that means that you have been determined to be eligible as an essential worker, and you should check that box and go ahead and get your vaccine. Now, a lot of folks have said, well, I'm not eligible in Group 3, but I do have some form of medical condition. Will I be in Group 4? Now, a specific list of conditions are listed for Group 4 at the North Carolina Department of Health and Human Services website. But really, you should consult your healthcare provider directly if you have any questions about your eligibility or about your health status. A common question we've received from those who have had the vaccine or who will be having it soon is, do I have to keep wearing a mask, doing social distancing, etc. after I get the vaccine? And the answer right now is yes. We don't know if the vaccine keeps you from spreading the virus to others, so it's important to wear your mask, maintain social distancing. Surveillance testing is also still required even if you've received the vaccine. And the Duke Compact and Duke COVID-19 policies do not currently have any exemptions for vaccinated students, staff, or faculty. We hope that this video has been helpful, and as always, we're happy to answer any questions. This is a very challenging time with a rapidly evolving circumstance, and GPSG is here to advocate for the needs of our graduate and professional students to ensure access to this incredibly important COVID-19 vaccine. As always, if you have any questions, comments, or concerns, please don't hesitate to reach out to me at jay.lusk@duke.edu. Take care and stay safe.